Hi, I'm Dr. John Parker. This is my wife, Dr. Alexa Parker. You're on our thyroid website, and we want to go over some things today, what we do in our clinic from a holistic and an integrated functional medicine practice, where we look to get to the root cause of why you're having thyroid issues.
So, if you're struggling with some of the symptoms of thyroid problems, you're generally going to have difficulty losing weight, you're going to be cold all the time, weight loss resistant, fatigued, thin hair, brittle nails. These are some of the typical signs of a thyroid challenge. However, most thyroid challenges are actually an underlying autoimmune issue. About 90% of thyroid issues are actually called Hashimoto's thyroiditis, and this is not a problem with your thyroid, but it's actually a problem with your immune system attacking your thyroid. Unfortunately, the medical community mainly just work to put you on medications such as Synthroid or levothyroxine, therefore getting your numbers corrected. However, they're not really addressing the autoimmune component of it.
And most of the time they still have the symptoms. Probably a lot of the time we have people come see us that are on medication and they still have the symptoms because it's an autoimmune condition.
Absolutely. 9 times out of 10, it's an underlying autoimmune issue. Sometimes there's issues with T3, T4 conversion, always that we look at adrenals and we look at other things as well. But generally, we really want to make sure that you don't have an underlying autoimmune issue. To do that, to check for that, there's a quick, simple test that we do. It's called TPO antibodies and thyroglobulin antibodies. And that way we can determine if someone has an underlying autoimmune issue. And if we find out that you do have that, again, we have to go back to the immune system. It's really the underlying cause. So we look at things like the gut system, really address the gut. We look at underlying infections. And most of the immune system is in your GI tract, so we have to address these things in order to really take the stress and pressure off of your immune system. For example,
if you have an immune system problem, the first place to look at is in the gut system. So wouldn't you want to know what foods are driving my immune system problem? So one of the things we do is we run a 100 food panel, and we look at to see a delayed food sensitivity to see if your immune system is reacting to the foods you eat. That would be the first thing we want to know. And so, for instance, we ran this test on somebody. You're going to want to get this test. This test shows you this person had reaction to dairy products, very heavy to casein, problems with eggs, somewhat of a problem with gliadin and wheat. Peanuts, they were off the chart for peanuts. They had problems with pineapple and kidney beans. So by identifying the foods that you react with, you can get the immune system to start calming down. So it makes sense, wouldn't it, to get the test so they can see what foods I'm sensitive to.
Definitely makes sense, because not only, we have a huge problem in the United States that over 50 million Americans have an autoimmune condition. That not only thyroid, but lupus, rheumatoid, MS, Crohn's, and all of these are basically an epidemic in this country. So in our office, we really work hard to really decrease inflammation in the body. We really work hard to get to the root cause for each person. Each person is different. Rather than just trying to correct the blood markers, we want to correct the underlying causes. And we find that, most of our patients, we really look at, food sensitivities, deficiencies, we look at correcting underlying infections, and also we look to correct some of the genetic problems that patients have, and we're able to test for that in our office as well.
So when we say what we do is we have a functional genetic testing that we do, and we support pathways that are weak, that need support nutritionally, because if there's supports for those pathways genetically, you could have a reduction of 30 to 70% of your ability to heal, make energy, and detoxify. We see that all the time.
Absolutely.
The other thing we run a test on, we run a 34 panel vitamin nutrient deficiency test. If you have deficiencies, it's usually not just it's in my diet. I have problems in my gut system where I'm having deficiencies, like I'm not on the right digestive enzyme. I have infections. A lot of people have infections in their gut system: Salmonella, H. pylori, Listeria, You could go on and on about the things we see, and also small intestine bacterial overgrowth. So if you have a dysbiosis and an overgrowth in the most pristine area of where you absorb your nutrients, it's going to be a big problem for you. So we do some things to find out, testing where you have that. What we do nutritionally is to heal the body, get you absorbing your foods, get rid of the deficiencies, and we also work on some detoxification, because everybody has a huge toxic burden in the United States. We see Roundup, pesticides, chemicals, heavy metals. You have all of those things as a toxic burden, so you have to get rid of that too. Sensitivities, toxicities, and deficiencies. If you can address those, you'll be so much healthier and your immune system will calm down.
Absolutely. And, if you're feeling cold all the time, if you have no energy, at 3 o'clock comes around and you're exhausted, you can't get out of bed in the morning, you're really struggling.
Brain fog.
Brain fog
all the time.
Definitely. I definitely encourage you to call our office and schedule for a free consultation. One of us will sit down with you and go over your health concerns, your health goals.
We'll look at your history, tests that you've had done. We'll evaluate your need for, do you need these type of tests? And what we'll do is we'll sit down and go over and outline. We do that as a free consult.
Determine if we can help you.
Just see where the starting point is to get you back on health. Take a look at the website. Click to load up on the website for a free consultation, or call the front office. Talk to June. She'll be happy to help you, guide you to get in, make a consultation appointment with us, and we'll take it from there.
Thank you, and thanks for watching.